name?
Hi, my name is Jean Kraft. I'm a pediatric critical care physician. I take care of children who have the worst that the world has to offer them. I don't take care of children with mild manifestations of vaccine-preventable diseases. I take care of the children that are dying of them. And my response to this bill is a respectful, no thank you. That's a part of my business that I could easily do without forever. A young man, 12, screaming in agony as he is moved from the stretcher to the bed in the ICU. My feet, he has screamed. What is wrong with my feet? I pull up the sheets, and the meningococcal bacteria that is invading him has started killing him at the feet and at the hands. They are black, dead, never to recover. He receives the best that medical care can offer him at the Children's Hospital of Philadelphia, not a shabby organization. By the next day, the death that started with fingers and toes and hands and feet is now up to his elbows, up to his knees. But at that point, it doesn't matter that we cannot save his hands and his feet, because that death has now happened to his brain. Within 48 hours, he is dead of a disease that is now preventable. In my first year of training, as Dr. Fisher said, I saw children with Haemophilus influenza type B illness die on a regular basis in the hospital. By my third year, no one died because they were vaccinated.
Thank you. Thank you. All right.
Thank you, Mr. Chairman. Members of the committee, I'll be brief. I'm probably the oldest guy in this room. I'm a pediatric infectious disease immunologist who's been involved with medicine and the care of patients for almost 45 years. I have seen thousands and thousands of children dying of vaccine-preventable disease, not just in the United States, but around the world. I've gone to a hospital in Calcutta, India, when I was consulting for the World Health Organization, where I saw 20 or 30 children with acute polio and probably 200 children recovering and getting care for the ravages of polio. I've seen children born with congenital rubella who either died slowly over months or were forever, their whole life, maimed by this congenital, now vaccine-preventable infection. Ladies and gentlemen, you have an immense responsibility before you today. With your vote, you can prevent the deaths and the ill health in thousands and thousands, if not 10,000s, of people in New Jersey. The medical community serves as its goal to help people, not to hurt them. Nothing is perfect, vaccines aren't perfect, but the risk-benefit ratio of immunization is like 10,000 to 1 in favor of immunizations.
Wow, tell me.
That's a good place to end. Thank you. Next, we'll bring up Dr. Frankel.
I'm Larry Frankel.
Excuse me.
I should add, if I may, for just a half second, I'm just going to tell you. I'm the co-chair of the New Jersey Immunization Network. Ladies, didn't your mothers teach you how to be polite?
Next, we'll bring up Flora Rice. RN, Carlo, Deliza, Kathy Whitehead, New Jersey Association of Public Health Nurses, Ms. Carlo. Carlo, you're with the New Jersey Health Workers Association.
I'll be brief with the statement of testimony because it will, I will bring. Good morning, Chairman Conaway, members of the Health and Senior Services Committee. I would like to thank you for the opportunity to speak with you regarding 1743. My name is Carlo Delizia, and I'm the health officer for East Gifford Township in Morris County, and I'm here on behalf of the New Jersey Health Officers Association, a private, non-profit organization of public and allied health professionals whose members have been protecting New Jersey's public and environmental health since 1911. As a public health officer, covering the catchment area consisting of nearly 70,000 residents, 21 public schools, 31 daycare centers, approximately 12,000 school-aged children. Over the years, my staff have worked tirelessly in educating the administrators of these facilities while conducting immunization audits to determine if the children are in compliance with the JAC 8:57. For the most part, the school nurses and the daycare centers are well aware of the requirements of the regulation. Our concerns arise with the parents, guardians, and sometimes physicians that feel that they can pick and choose which vaccines their children can have administered. There are sections in the current regulations that allow for exemptions for medical and religious concerns. We have seen this most recently with the newest provision of children ages 6 to 59 months that are now required to be vaccinated with influenza. A brief example of this was last year we had a family with 3 school-aged boys attending daycare in public schools that needed to be in compliance with the influenza requirements. After numerous attempts in educating the parents on the regulation, it was not until after 2 of the 3 children were hospitalized with influenza that they brought the third to be vaccinated.
Are you Ms. Rice?
I am Florence Rice. I'm a public health nurse at the Madison Health Department. We cover 6 towns by contract, excuse me, for public health services in Lawrence County. We have been auditing preschools and schools for all those years. I have data the last couple of years that shows exemptions, either medical or religious, are 1% or below, meaning 99% of children are fully immunized, and we can sleep well at night because we know that we are doing all we can to protect the children in our area and the communities that we serve.
Great, thank you. Kathy Whitehead, right?
She's not here.
She's not here. Okay.